guys, Nurse Chuckles here. I know my cloned voice is a bit weird, but let's roll with it. Did you know that 75% of nursing students struggle with renal and hypertension questions on the NCLEX? Let's make sure you're not one of them. First up, renal failure. Renal failure can be a real pain in the kidneys, but don't worry, we've got you covered. Know your symptoms: fatigue, swelling, and shortness of breath. Next, hypertension. Remember, it's the silent killer, so understand the risk factors, such as obesity and smoking. For ACE inhibitors, think of the prils, lisinopril and enalapril. They sound like fancy Italian dishes, but they actually help relax your blood vessels, lowering blood pressure. Now, diuretics. You'll hear patients say water pills referring to their diuretics. Diuretics help your kidneys remove extra fluid, such as hydrochlorothiazides, furosemide, etc. But watch out for side effects such as electrolyte depletion or dehydration. Diuretics that aren't potassium-sparing can lead to hypokalemia. An example of a potassium-sparing diuretic is spironolactone, aldactone, and allows the individual to get rid of water and sodium without dumping potassium. Hyperkalemia means high potassium levels. Look for muscle weakness and arrhythmias. Think of it as your muscles throwing a tantrum. Hyperphosphatemia is high phosphate levels, often seen in renal failure patients. Symptoms: bone pain and itching. It's like your bones are saying, hey, we need some attention here. Stay sharp, stay focused. You've got this. Here's a sample question. A patient with chronic renal failure presents with hyperkalemia. What is the priority nursing intervention? A. Administer sodium polystyrene sulfonate. B. Encourage a potassium-rich diet. C. Monitor for signs of dehydration. D. Provide a high-phosphate diet. The correct answer is A. Administer sodium polystyrene sulfonate, also known as Kxalate. Think X out the K. Another one. A patient with hypertension is prescribed lisinopril. What should the nurse monitor for? A. Hyperkalemia. B. Hypotension. C. Hyperphosphatemia. D. Dehydration. The correct answer is B. Hypotension. And one more. A patient with renal failure is experiencing bone pain and itching. What condition is likely present? A. Hyperkalemia. B. Hyperphosphatemia. C. Dehydration. D. Hypertension. The correct answer is B. Hyperphosphatemia. Practice these questions and you'll be ready on the right track to conquer the NCLEX. And remember, laughter is the best medicine, unless you have a broken rib. Then maybe not so much. You've got this. Now go out there and show that NCLEX who's boss. If you're not ready, then Google my 2 cents community help services and let's get it poppin'.